Hello, can you hear me? Yes? Okay,
Yes.
great. Well, I have the great pleasure to welcome you to the first of our series of Community Engaged Research in Action Grantee Project Showcase. I'm Ewan Wong, and I'm the co-chair of the grant review panel with Dr. Bonnie Halpern Fleischer, who unfortunately could not make it today. And I just wanted to add one brief thing off the script, which informs our evolution and work. So initially, a long time ago, this was an MCHRI grant titled Research on Structural Racism, Social Injustice, and Health Disparities. But we realized very quickly that in order to accomplish this work, it required the involvement of the communities affected, and thus it was renamed and refocused to the Community Engaged Research to promote health equity pilot grants. And over the years, we've been so excited about the work that has come out of this grant mechanism. And today we have the opportunity to showcase two innovative projects funded, um, showing how academic partnerships can advance equitable care for adolescents. So the featured projects today are one, improving health care access for migrant youth through co-design and participatory research methods. The PI is Dr. Shazeen Suleman, and she was a clinical associate professor at Stanford and has since moved back to Canada, where she's joining the University of British Columbia and British Columbia Children's Hospital as an associate professor. She has a new baby and is on maternity leave right now, so we really appreciate her coming. Her community partner and co-investigator is Lilly Quinonez. She is head of the Newcomer Welcome Center at Sequoia Union High School District. The next project is the Teen Van Relationship Strengthening Project, advancing a holistic approach to adolescent health care. The PI is Dr. Greg Walton, and the community partner and co-investigator is the Teen Van with Arash Anoshiravani, the clinical professor of pediatrics, who is in charge of the Teen Van, and then Jesus Cubilla, who is the research coordinator of Lifting the Bar. And then, of course, I introduced everything, and we have a couple of information about MCHRI before we begin. Mario? So we couldn't do this work without so many people behind the program. This is our education committee who oversees not just these grants, but all of the educational series that we present. Next slide. And just to let you know, we have a couple of upcoming seminars. The Trial Innovation Network and why you should know about it. March 9th, 2 weeks, I think, coming up from 12 to 1. Expanding the Evidence Base in Pediatrics by Manisha Desai and Michelle Odin in April 13th. And Dongmei, can uh, people will get the notices in their email, but can they also register on the website?
Yes.
Okay. And then even more upcoming seminars. You can see that we have a seminar every month, mapping the roots to building and rebuilding the mammalian heart in health disease, creating human blood vessels to study vascular development and disease in June, and then January of 2027, wearable ultrasound technology for fetal and maternal care. And then this is where I should have done the in-depth introductions, but we are so excited to have the first project presented by Shazeen Suleman and Lilly Quinonez. And we have two presentations and we have a very short 24 minutes left. Um, Shazeen and Lilly, do you want to entertain questions at the end? During, do you mind?
I,
I think we have till 1. Is that right, Dongmei? And we're going to speak for about 20 minutes. And yes, we'll do questions at the end, maybe with everyone.
Yes,
Okay.
sounds good. Thank you.
But you can also feel free to put questions in the chat and I can keep track of them.
No problem. As Dongmei is getting our slides up, because I think we're still uh, getting organized, I did want to say congratulations on your 2 gold medals in hockey. My country is in mourning because this is a big. I wish I could tell you that I was joking when I say like we stopped. It's a big thing. But congratulations, we are very sad, and we will see you again in 4 years in those hockey finals. So I am really delighted to be sharing space again with someone who became a dear friend through this work with Lilly Quinonez. And I think that's, you know, part of one of the benefits of doing community engaged work is you develop friendships and relationships outside of where we normally would meet people. And we're going to tell you about our project that we call Dream for Health. And so next slide. Yes, I can see them, Dongmei. So I think everyone else can see them. So we're going to talk to you kind of about our process where we built a youth advisory board at Sequoia, and also some insights that we've had around our real aim, which was how difficult it is to access care for newcomer youth in the county, and share our reflections on working together and what that means for the future. So next slide. So I'll let Lilly introduce herself.
Hello, everyone. Yeah, my name is Lilly Quinonez. My title here at the Sequoia Union District Office is Family Newcomer Liaison, and it's an honor for me to work for these families and students.
And Lilly, what do you, maybe you can tell folks just a little bit about what the Newcomer Welcome Center does.
Yeah, so the Newcomer Center started 4 years ago, a little over 4 years. And it was during the time of all these students, young children coming to the United States without families, some with families, some with no families. So the district designed this program to better help them, to serve them better. And one of the obstacles, of course, was having healthcare. And we're going to tell you a little bit more in a little bit. But the Newcomer Center is the place where families can just come to one place before they go to their school that they're being accommodated or designed to, so they don't have to struggle with finding the right school or who is going to help them. So this is why the Newcomer Center is here at the district office.
Thank you so much, Lilly. So on this slide, you will see a spark. And that is basically, the reason I picked that is because that's how this project started. We sort of, and I'll tell you a little bit about how we met. I had just come to Stanford. I didn't know anybody. I got an email from a colleague saying, oh, you're interested in newcomer health. I think you should go to this convening that's being organized by the Stanford Immigrant Child Health Lab, led by Dr. Wang, actually, and Dr. Ryan Matlow. And so I came into this meeting. I didn't know anybody. I remember sitting down, getting to know folks. And then I happened to sit with a small group of people, including Lilly. And then maybe Lilly, you can tell them what happened next.
Yeah, so exactly. It was the same way for me, right? I was new in the position, and one of the big struggles was finding services for the students, because without immunizations, it was impossible for them to go to school. So it was a big obstacle. So I went to this convene with where I met Shazeen, and one of the things I said is, during that small group, is I have a big problem. I have the students and they cannot go to school because they don't have immunizations. And she looked at me like, what? They don't have immunizations. So it was like this connection right away. I can fix that. I'm like, oh, you can fix that. How can you fix that, right? So we start talking about it. And she's like, send them all to me. And I look at her, I'm like, all of them? And she's like, yeah. And then she's like, how many? I'm like, too many. Like, over 100 students. Like every day we had like 20, 30, so many students. So that's how we end up having this amazing connection.
And so on the next slide, actually, I was not joking when I said send them all to me. I was working at Gardner-Packard Children's Health Center. And again, with the great support of our medical director, Dr. Elizabeth Stewart, we created a little pathway so that Lilly could contact the office, and we could get appointments for them within, any students coming through the Newcomer Welcome Center within 3 or 4 days. In that visit, we would enroll them in Medicaid, we would update their vaccines, we would do best practices for screening, and we would also connect them to social services for food, immigration support, transportation, and core services. And in 1 year, we had almost 350. This is 1 year data, and it now expanded to Redwood City School District, which are the junior kids. This was great, right? You could have said maybe this is where our work stopped, but this is actually where our work began. So on the next slide, we said, I think Lilly, you and I were like, this is just the beginning. And so we realized this was dealing with an immediate need that was in front of us, but we wanted to understand a little bit deeper what the youth were experiencing and actually invest in their development and really pay attention to what they wanted to do. And so that's what made us apply for an MCHRI grant together. And we were really honored to have been awarded this grant in 2023. So on the next slide, I'll tell you what our project was about. We had 3 aims. So one aim, as I said, is we really wanted to focus on the young people. I think, Lilly, you told me about so many of these young people that were coming to you, and you really wanted to encourage them, empower them, and hear from them. So we thought, why don't we try and build a youth advisory board at the Newcomer Welcome Center? Using that and working with that youth advisory board, then let's actually understand from the youth themselves and their parents, what is the challenge in getting healthcare and what might be helping them. And then together build, we didn't know what it was going to be, but build something that was actually going to help them connect to healthcare depending on what they said. So this was our project in 3 arcs. And so I'm really excited to tell you about them. This is our youth advisory board. And this was at one of our last meetings. We actually have 9 members, but 2 couldn't make at certain points, it was very flexible. And when you're working with young people, it's important to have that flexibility, recognizing that not everyone will make it at the same time. But we even have young parents as part of this advisory board. I don't know, Lilly, do you want to share a little bit more about the youth on the youth advisory board?
Yeah, so we were so lucky to have students from different angles, right? Different life experiences. And like you see right here, this baby, this mom, this teen mom, she was with us in the beginning when she arrived from her country. And then during the years, through whatever happened to her, she ended up having this baby also, who was also member of that clinic now because of the connection and the knowledge that she was able to gather during these groups. And yeah, we had 2 students who were not able to make it to the last meeting, but they were also super involved and willing to just continue with this amazing work out in that community.
And all of these youth had experience being newcomers. Some of them are now reunited with their parents. Some of them are not. Some of them have experienced horrible things like trafficking. Some of them are going through their immigration process right now. And so we had this diversity of experience on this board. And so let's tell you what we did with the board. On the next slide, please. So, the first thing we did is we built community. And so this is from one of our earlier meetings, and you can see that a prominent theme at every meeting is food. And that was one of the things the youth said is we have to have food at every meeting. They created their own WhatsApp group. They created a logo for themselves. They called them the Sonodares, like the dreamers. And we also started making a playlist. We learned that they liked Drake. They were very excited that Drake is from Canada, and so am I. That was a big connection point. And we met periodically throughout the year. We would meet at the school, and they oversaw the project from start to finish. And so this is just, again, highlighting what an advisory board meeting might look like. Next slide, please. So after that, initially when we met with the youth, we came up with an interview guide and thinking about how we were going to hear from other youth. And this led us into aim 2 of our project, which was a qualitative study looking at asking about the barriers and facilitators to healthcare from youth and caregivers. We spoke to 21 youth and 6 parents through focus groups and interviews. focus groups and interviews were done either in English or Spanish. And they were done, again, using both purposive and snowball sampling. And currently, we have a wonderful undergrad student, Rachel Youngwood, who is analyzing all of this data, but there's some high-level themes that came up. One thing that stunned us was that youth and families often use the word horrible or hell to describe their first experiences with healthcare when arriving in the United States. Some of these were on arrival at their first entry point, and some of these were later. And they had really vivid descriptions of feeling like they were poked like a pincushion, not knowing how many shots they were going to get, not knowing where to go, not knowing who to turn to. That even though many of them were eligible for Medicaid, they didn't know. They didn't know how to apply. They didn't know where to go. And the biggest source of support was community. And so people who had family members who had been here for a little bit of time, that was a big source of support. But those who came alone really relied on the school, and Lilly was a huge source of support for them, which helped us identify as potentially a really critical step then is working with schools to help young people who are newly arrived without any support connect to healthcare services. And that led us into our co-design work on the next slide. So we then went back to our youth advisory board with some of these high-level themes, and we said, so what would support look like? What should this be if we know that schools are a really important source of support, and there's all of these barriers? What do we need to do to help? And this is actually what a co-design session looked like. And the youth developed what they called a folleto, or a pamphlet that was written in youth-friendly language with QR codes and links to specific services that could be given out by youth in the schools themselves, by peers who were trained in knowing about where to go and who to talk to, sort of like a peer navigator program. And that's then what we started to build. And we started on the next slide by actually training our youth advisors to be the first peer mentors. And so this is from one of our training sessions where we had individuals from legal aid, individuals from the county come in and teach the youth themselves about this is how you apply for Medicaid. This is where the clinic is. This is what you actually need to go to a clinic for versus a hospital for. This is where mental health services are. This is what you need to ask about when you go for legal services. This is the phone number to call for rapid response. So this is an example of the youth training. I don't know, Lily, do you want to share any reflections from that training session?
So yes, one of the things that I can share during this kind of trainings for the students is that all the knowledge they were able to go and kind of help their family members have a little bit more peace of mind. What are the steps that we have to do? Because whoever is in charge of them, family members, they don't know what to do because they don't have legal custody over them. Or if the parents are with them, they actually don't know where to start. So for the students to be empowered and getting all this knowledge on what are the steps that they have to do, that was very powerful.
Thanks, Lily. And next slide. And so then we asked the youth advisors in our last meeting, how was this experience for you? And we were really humbled by what they said. They said that being part of the youth advisory board has given them confidence to actually speak up in class, that they've actually felt more empowered to use their own voices. One of them has gone to has really excelled, and a few of them are applying to college and are writing about this experience in their college entrance essays. One of them shared that they've actually gone and spoken in front of a class of English language learners in the high school and said, hey, I was one of you last year. Don't let this hold you back. You can still apply for college. Another one shared an example that they were in an Uber and their Uber driver started telling them that they didn't know what to do about Medicaid. And they were like, I know what to do. I told them where to go and I told them how to get health insurance for them and their son. And I was so proud. And I think really what we developed community as a group. Lily, do you want to share anything else about
Yes, we
what the
have one of the
experience
girls
was?
also who she's passionate doing studying medicine. She's
Yeah.
one of the ones who are applying for college, and she's like, I want to do this. I want to help people in this way because this is powerful, and I want to make a difference. So that's great.
So, again, we tried to have this presentation be more conversational and more reflective, and thinking about what this means. For me, as a relative newcomer to the Bay Area, I could not have understood what the needs of the patients I was seeing were unless I was working with the community members and in a space um, that wasn't quote unquote mine. It wasn't healthcare. It was me at the school where the students were comfortable, where families were comfortable. That's how I got to learn more hands on around what their real day to day experiences were. And it helped me be a better clinician by also understanding and developing relationships with the frontline workers who are actually supporting these families. Um, Thirdly, I think, I would never have been able to come up with this intervention alone in my little office at CAM, thinking about what intervention is best for families. It's always important to develop it with community because you can see it's now been quite impactful. Our intention is once we're finished the prototype to actually test this prototype in future studies and working with different different education networks across the state to see if this can be piloted in a few different districts to see if that will also help youth. And as I said at the very beginning, community is so important, but also community for us. I didn't know many people when I moved to Stanford, and I developed friendships with Lilly, and that I think is something that I'm going to carry forward with me forever. Lilly, would you like to share your reflections on this partnership
For
and maybe
me,
like what the youth have gained from this?
yes, and also for me as a family liaison at the district office, I've been blessed to have a insurance company for life, right? I mean, I've been in a stable job forever, but working with these families, navigating myself, the health care system for public, it was very confusing and it was very stressful. So I totally understand, but basically for me, I was with them, walking those steps with them, trying to figure it out, where to go, who can help us. I have a wonderful friend that I think we shared the same friend with Nancy, Anne Banchap, who was my my guide, my angel, telling me, no, just you should check this, you should do that. So for me, working with Shazeen and going to this event that they put together for community and building this partnership with Shazeen and helping families, seeing the effect of having a connection with a health provider that is willing to help families all the way through. For me, that was personal. It was a blessing.
And I think the youth advisory board is going to continue at Sequoia. Is that right?
Yes.
Yes. And so this is again an example of sustainability and being able to ensure that the Newcomer Welcome Center can continue to do this. I know the district was actually really excited about the work that we've done together, and we are also in the process of preparing a report for the district to highlight the importance of youth involvement as advisors. Because I think one of your supervisors had shared, Lily, that there was a parent advisory board, but you never had a youth advisory board now. And now the youth advisors are going to inform other elements of programming in the district.
And just the fact that we have this connection and this partnership, we were able to identify students who had special needs and have their letter ready before they went to high school. Like have all the information ready so they can provide the right support with the right IEP, with the right recommendations. So this is that's a key for the students to be successful in school.
So next slide. So, we wanted to just say thank you. This was, again, a high level overview of our project. It's not finished yet. We're still finishing our analysis. We've actually just submitted something to the International Migration and Refugee Health Conference that Lilly is a co-presenter on. We'll find out if it gets accepted. And we're finishing up the prototype for the pamphlet that can be distributed as well. But we're really excited for your attention. We tried to stay exactly on time. And so here are emails for anyone who wants to get in touch with us after. We look forward to your questions. And Dongmei, back to you.
Thank you.
I don't see any questions on the chat, but does anybody have one or two questions right now for Shazeen or Lilly?
I have a quick question. This is a really cool project. I'm a medical student. My name is Samia. I am wondering, did you guys recruit your youth advisory board through the school district, and did you have to get any extra permissions, I guess, for like recruiting for the advisory board or?
Yes, so for the newcomer office, what I do for new students, every beginning of the semester, I go to the school sites and I do a community circle with the newcomers. So this is for them because every time we have new students, so the community circle is just to get to know each other a little better, so they know that they have someone at the district office who's going to advocate and look out for them. So what happened in there is we kind of build the community with the groups of students, and based on that, I will offer this opportunity for the students, and whoever says, yes, I want to be a leader. Yes, I want to learn more. So then that's how I reach out for to bring students to these groups.
And Somia, to your point, as the researcher, this is the critical role of us having partnerships with community. So I'm not parachuting in, trying to develop the relationship. I'm working with Lilly, who already has these trusted relationships and support from their parents through that community circle, or their caregivers, or whoever is their guardian. Does that answer your question?
Yes, totally. That's very helpful. Thank you.
No problem.
Any?
All right. Well, Nancy and Dongmei, is it okay if we start now? I don't know how we're going to follow up on such an amazing presentation and project, but but Jesus and I are going to try. I'm really honored to be here along with Jesus Kubia, who is representing the Professor Gregory Walton's group from the Department of Psychology at Stanford. And just really briefly, I know we have a bunch of slides, but I just wanted to say, you know, I had the serendipitous experience of running into Greg Walton at some campus meeting, and hearing, you know, we were kind of going around talking about what we liked, what we do, and what we care about. And after he spoke, I kind of looked at him and thought, how come I've never met this guy before? And then after I spoke, he kind of looked at me and kind of had a quizzical look and like, who is this guy? And we both realized that we needed to talk. And what we're going to talk about today is sort of bringing together a project that Dr. Walton had created, Professor Walton had created in the juvenile justice system, basically to reconnect youth in that system to adults in their schools once they re-entered their communities. And he was able to show an incredible impact that Jesus is going to talk a little bit about later on. And you know, as we talked and kind of formed this partnership, which is actually is within Stanford, we realized that we needed to see if we could bring some of this work that he had started with his team into the community settings that the Stanford Teen Van is in. And so that's kind of what this project is about. So anyway, that's just to start off. So I'm Arash Anoshiravani. I'm the medical director for the Teen Van, and Jesus.
My name is Jesus Manzocovia, and I'm the research coordinator for the Within the Bar program. Pleasure to meet you all.
Next slide, please.
So today we'll go over the project background. So what is Lift in the Bar, what is Teen Van, and our collaboration together and our aims. Then we'll go over to progress to date, so some accomplishments we've had, and then an overview of some barriers that we've come across as we've implemented this project within the community. So as we're discussing, we would like you to think about this question. Questions. When you were younger, did someone see in you the good and successful person you could become? Maybe even before you could see this for yourself. What impact did this person have in your life? Next slide.
So as ways of introduction, what is the teen van at Stanford? Basically, I'm actually in it right now. So behind me, you'll see I'm in one of the exam rooms, but in clinic today. But the Stanford Teen Van is a mobile health clinic that is part of Stanford Children's Health, providing comprehensive health care to homeless and housing insecure, uninsured and underinsured youth ages 12 to 25. We are now entering our 30th year of doing this throughout the Bay Area. We travel to schools and community sites across the Bay Area on a regular schedule, delivering kind of a broad array of healthcare, medical, reproductive healthcare, mental, behavioral healthcare, diet, and nutritional healthcare directly to youth where they actually are. Today, we are at a site called the San Jose Conservation Corps in San Jose that serves 18 to 25-year-olds who have, fallen off of the educational track, maybe because they were in the juvenile justice system, maybe because they were homeless, maybe they just had a detour due to family situations. So that's where we are today. We average about 2,000 visits per year, serving about 600 unique individuals annually. Next slide, please.
So what is Lift from the Bar? Lift from the Bar is an online platform. It's a self-guided and held on qualtrics, and it allows adolescents an opportunity to reflect on their values and goals in school, educational experiences, and also has the platform to be able to share advice for future students navigating the education system. And this is adapted in various contexts they hear with the teen band, English language learners, students in foster care, and so on. And with that, they also have the opportunity to share a little bit about themselves to a teacher through a letter that is created through the Qualtrics platform. And what they want to share is specifically on a little bit about themselves, their goals, and any difficulty that they have, which they would like a support from an educator from. So they nominate some adults, and one specific adult will receive this letter, and the other adults are just for backup in case they may be unavailable. But that is a little bit about Lifting the Bar. I'll go into detail shortly with some other slides. And the goal ultimately is to strengthen, go back to this slide. The goal is to strengthen educator-student relationships and focuses on the students' well-being and growth. In the next slide. So what is it impacting Lifting the Bar? So Lifting the Bar was initially adapted for students coming back from the juvenile detention system, returning into school. It was first implemented within the Oakland Unified School District with Miss Patty Tates. And what we found by the student introductions and reflection platform and being able to share advice through the online platform is that a huge statistic in which recidivism dropped by 40 percentage points from 69 to 29%. That is a huge and sobering statistic. And this is simply by this online platform in which they reflect and share a little bit about themselves, create their narrative, and share that through the letter to an educator. Further experiments in which we share this letter to an educator has also given like positive responses from educators and changes like their perception and behavior, such as it increases positive affect, improves teachers' beliefs and expectations for students, it increases teachers' willingness to play a mentoring role for them, and also increases positive responses to student misbehavior, such as empathetic and growth-oriented responses. Further, it's all, as I mentioned, it's adapting for different contexts. So what the students here in the Lifting the Bar platform and the Teen Man is different from, say, what students from English language learners, students in foster cares, and so on here in different adaptations and contexts of Lifting the Bar. Next slide. So why this partnership? Well, we find that educator-student relationships are critical for adolescent development and their health. And the problem is that there's a huge gap here. In California, over 40% of ninth graders reported not having a caring relationship with an adult in school. And this metric alone has not improved almost a decade later. And this number only plummets nationally. Only 15% of students report having a mentor in school. That's huge. And then further, there's also an equity gap. Relationship access is lowest for students of color and students from low-income families, despite being most valuable to them. And this is where we come into play, where we have this cross-sector partnership in which we implement the intervention lifting the bar within the teen band and the schools that they serve. And this allows us to really, the students, for them to, really create their narrative, like really reclaim that and strengthen their connections on their own terms, and hopes to help improve adolescent development and their health and their connection with an educator.
All right. So we wanted to kind of update everybody on our progress to date. It's been an eventful kind of year and a half of work. And so the four areas that we kind of wanted to talk about were kind of our integration of the lifting the bar assessment into our clinic setting, which has been really successful. And we can talk a little bit about that. Adding a key question from lifting the bar into our standard teen band patient survey. The other has been kind of more of a regulatory sort of IRB milestone, which is finally getting approved after multiple iterations and multiple IRB interactions. The third thing was, and Jesus will go into this more in depth, but getting youth-centered feedback and gathering feedback from our patients about the core lifting the bar interventions, their thoughts on it, and how we could integrate their input into what we were doing. And then finally, some preliminary analyses looking at data from our lifting the bar assessment compared to patient level correlates. So next slide, please. So the first area was really, the first thing we did when we started this partnership was build into an existing clinical tool that we have on the teen band, which is basically a 10 question survey for young people who are visiting the van. Usually the questionnaire takes about 2 to 3 minutes to complete and gives the clinician, usually me and or a resident or our nurse practitioner, a good sense of kind of the behavioral, mental health, and social needs that our patients face. We decided after some discussion and after some feedback from youth to add this question: is there a core academic teacher at school who knows you, understands you, and cares about your success? To the questionnaire. These are pretty simple questions. They're often yes/no questions. And so we started putting this question into our routine clinical care questionnaire from the very beginning of our partnership. Next slide. And just to give you a sense over the last 700 patients who filled this out over the last year or so, these numbers were a little bit confusing to us initially, but 78% or so of our patients have responded that yes, they definitely have a teacher in their school who cares about their success, which is remarkable. Actually, it's quite amazing that they're that high in the schools that we go to, that our patients, who often are higher risk patients and experiencing a lot of difficulties in their lives and in their schoolwork and everything else. And almost 22% say that they don't really have an adult teacher who understands them or cares about them, or that they prefer not to answer. Next slide. And just as kind of looking at this preliminary, we have a sense of gender identity from our questionnaire as well. And it at first analysis, it looks like there are more young male identifying patients who do not have an academic teacher who they feel understands them or knows them or cares about their success. Next slide.
So talking about the institution review board and some challenges we've come across. So because this project sits within medicine, social and educational psychology, we were first prompted to complete the medical RB, which is a little bit more rigorous. And on the lifting the bar side, we've always done non-medical, but we had to complete like various questions and have to go through like a lot of rounds with the medical RB. And this took a long process, and just to be prompted to do the non-medical RB eventually. So we had to start from scratch, and this was quite the process. But as of this month, actually, on February 10th, 2026, we got the approval. So really great news. This was a 17-month, a year and a half process, which took quite a long time, but I'm not saying this whole process took a long time because of paperwork or anything. It's more so like the challenge here is that it leads to a barrier in which we can't help these adolescents. Like, we're trying to connect students to teachers to help them with their educational experiences, their development, and also health, which this intervention in the context of Teen Van really does help, and we're hoping to prove that. Yeah, next slide. You could click through them. So in more detail, as I'll discuss some responses from students, there's some more of the slides. So lifting the bar is an online activity held on Qualtrics. It's self-guided. You can like student voices, and maybe my voice or a previous research coordinator named Unmol. You can hear our voices narrating the whole process in which we discuss prompts, challenges that students have faced going to school. And this varies by the different contexts, such as EOL kids, foster kids, and so on, the folks that we're serving. And each adaptation again varies. Specifically in the Teen Van context is generalized and takes about 25 minutes. The whole process is about 4 parts. Students reflect on their personal values and goals in school, which I'll share some responses shortly. You review and reflect on stories from older students, which I have a story which we could hear, but not sure how we're on time. And then the biggest highlight is that they share advice for future students. We really emphasize to the student that you are the expert here. You are navigating the school system, and we want you to share advice to future students on how you navigated it. This all varies in different contexts. It could be like, I went to the college center, which really helped me out. I talked to my teacher and told them like, this is like a little challenge that I'm going through. And that made the teacher like realize that, oh, like this is why my student may feel some sort of way, why they might not be so engaged. Or like they share advice like that that really helps them. Like, this is what I've done, and I know this could help you out, which is like really, really nice. Further, through the letters I mentioned earlier, well, they see prompts, which is like they ask about their goals, values, and challenges that is then implemented into the letter, which Qualtrics produces. And I'll review those texts and just to make sure like grammar wise it's like good. But this is then sent in a 1-page honorific letter to a educator they selected. As I mentioned, they select multiple, but one specific educator gets that letter. And just for context, that an educator could be anyone. It could be the custodian, a principal, math teacher, chemistry teacher, and so on. But that is a little bit about that. Next slide. So I'm going here on a little bit of process how the platform shows it. It's not shown like this exactly. The Qualtrics platform has like images and some narration and so on. But here's a little bit of what we find for the students and the values they selected. So they're prompted like to select some values that is important to them. So you can see it says help support my family, loved ones, learn skills that can help me get a good job, prepare myself for college, and so on. And what stands out here is the pragmatic and relational nature of their motivation. The top 2 drivers at 71% are about future utility and jobs and duty to family. And again, for context, this is like within several responses. And this is coming from this Teen Van intervention implementation specifically. But as you could even see some responses here, I feel that academics are a very important aspect of life that allows us to achieve many goals. And the reason this is important to me is because I wanted to make my family proud and be the second person to go to college and help my family since they've always been there for me, which is all very touching. And I definitely resonate with these goals and aspirations these 2 students have. But it's really always just really touching students. Next slide. I only have 5 more minutes. This is a story. Yeah.
Play the story. Yeah.
Yeah, we could skip that. So this is how the letter looks like. If you do look closely,
Hey, so sorry, Nancy, did you want us to, Ewan, did you want us to play it?
Yes.
And
Okay.
if that's possible, yeah, it may take some time, but
Yeah, I mean, we
oh,
can go quickly through the rest, but
okay.
All good. Thank you for sharing.
Let me go to the story. So here's a student story that's specifically for the Teen Van context. Let me know if y'all can hear this.
no,
No?
I think you have to specifically share sound with it as well.
What was that?
Yeah, we can see the image, but we couldn't hear any sounds.
How do I share the audio here?
Well, I think when you click share, there's another setting that allows you to says share audio with it.
Let me try this again. I'll share sound. Let's see. All right, start that over.
My parents always told me I would be the first in our family to go to college and have a great job. That was always my dream, but when I first got to high school, I doubted myself a lot. Within the first few weeks, I felt like I was already so behind. I went to every class and tried to pay attention, but I was so tired from helping my parents out at home with my little siblings that I could barely keep up. I tried to understand each concept, but by then the class had already moved on to the next thing. It felt like a trap. Each time I tried to catch up, I just kept falling more behind. I got frustrated and didn't want to go or pay attention, but I also couldn't let my family down. I knew they were counting on me. I knew I needed to find a way to get help and keep me motivated in school. Growing up, I'd always watched my dad fix things around the house, and I enjoyed mechanics, so I thought about joining the robotics club at school. At first, it felt like the club just wouldn't be the right fit for me, and I was worried that Mr. T, the robotics teacher, wouldn't want to help me because of my grades. But I decided to join anyways, and it made all the difference. One day I stayed after school to finish a robot for my first big competition, and Mr. T was really patient with me. I was struggling to understand the directions for some new complicated tools, but he took his time and didn't mind explaining them slowly to me so I could understand how to work them. That was really helpful and helped me add a really cool feature to my robot. Being in the robotics club made me more motivated to learn in classes too. I could see how the content in my physics and math classes mattered in robotics. And even my psychology class too, when I wanted to create a robot that could respond to emotions. As I got more engaged, I started to feel more confident in classes. Through the club, I also connected with the director of a robotics summer camp where I was able to get a job as a camp counselor. It was so much fun to teach the kids some of what I had learned. And I was able to help my parents pay off some of the bills and make things easier for them. Now, I'm on track to graduate this June and go to college. I don't know exactly what I'll do in college, but now I can see a path forward.
Were y'all able to hear that, by the way?
Yes.
Cool. I could keep sharing. So this is how the letter looks like. And by the way, for context, the story is for specifically T-Van, and we like to emphasize the student agency to connect with the teacher and how it's helped them through their educational experience and success. This is how the letter looks like. If you look closely, it's tailored for the juvenile justice, but we just kind of use this one for because it's shorter, but it's also shortened within the content itself. But we talk as you can see, they share about their values, goals, and challenges, and I'll show the prompt shortly. But here's some examples. I want my teacher to know I'm working to be a better person. My goals are to graduate. I want to make my mom proud. and focusing in class can be difficult for me, which is shared to the educator. Um, and here's some responses from the team van when they utilize the platform. Here's a prompt they use, which is then implemented into the letter that Qualtrics produces. So what would you like to share with one of these adults? I'd like them to know that I appreciate the care they show toward the students and that I'm interested in academics. What would you like your teacher to know about your goals in school? My goals in school are to make better connections with teachers and to show them I really am trying my better in my grades. What would you like your teacher to know about what is difficult for you in school and that you would like to improve so they can help? Letting my personal problems get in the way and being scared to ask for help. So these very short responses really do make a huge difference. And I feel like just on my personal experience, being able to like tell my teacher, like, hey, like this is what I'm going through, like, or I'm having this challenge and this is why I might be behaving this specific way. It's kind of hard, like you don't just go up to the educator and just it's not that easy. But what's so beautiful about this platform, like it allows the student to like really create their narrative and share that to the educator, which really does make a huge difference. And we'll show some responses from educators that we have here. So this is specifically from the juvenile justice context, as we have not sent out letters to uh, and the teen van in the schools that we're working with, as we just received the IRB approval. But here's some examples. What did you think or feel about the letter you received? We basically in the letter they have a QR code and they respond to these questions for context. But as you can see, it says receiving a letter was a beautiful feeling. Knowing that I'm making an impact in a youth's life is something incomparable. Knowing that the student trusts me and believes me is not only me, but the work I do is truly amazing. I'm so honored. Please describe what, if anything, particularly you will do as a student integrates into your school and their class. I'll focus on creating a welcoming and inclusive environment where they feel safe and supported. I'll take time to understand his strengths, challenges, and learning style to provide personalized encouragement. As you can see, the educators really do respond very positively to it, and it really does make a huge difference in the student-educator relationship, how the educator perceives them, and they can do the best, put their best self as an educator for the student, and the student has like a greater experience.
So those letters are so powerful, I think, and the responses from teachers have been so powerful and make such a difference. We don't have much time. I just wanted to quickly kind of show what data we have so far in terms of trends that, the young people who are answering their teen van survey questions who happen to be on the higher anxiety area on their GAD-7 questionnaires are more likely to not have a teacher relationship. Next slide. And this seems to be, sorry, Jesus, if you don't mind going to the next slide. This one. It seems to be particularly pronounced in young women, in our female identifying students, such that for females lacking a teacher connection, they're twice as likely to screen high for anxiety. Kind of interesting correlates and things that we're going to continue monitoring. Next slide. But really kind of what we wanted to share are sort of these partnership issues that we've kind of faced. We're talking about a program through the school, through the university, school of psychology, that we're trying to implement within a clinical setting through the hospital and the teen van within the educational system and the ecosystem of schools. And this is something that I think, Jesus mentioned in terms of the IRBs. This is something that was just completely befuddling for them. How come the schools don't have to consent to this? And how come the teacher receiving a letter doesn't have to consent? There are all sorts of questions that came up, which I think to us seemed kind of ridiculous at first, but we kind of get it as well. Giving a teacher a letter that makes them feel good is not something that we need to get consent for, we don't think. However, getting the IRB had a good point, which is like, do the schools want this? And so we've been working with our partner sites, and we have, principals who got it within 5 seconds. They're like, I want this, bring it now, and so they understand the power of the student's voice in making that relationship with an adult in the school better. They just get it, and they don't need the research, although, Jesus and Professor Walton's group have that data. But the other reality is that a lot of these schools, there's a lot going on already. And even if they're enthusiastic, the bandwidth and the time to follow through is something that we are continuing to grapple with and try to manage our relationships with them well. And then realizing that really trust is the most important thing when it comes to these relationships. One of the schools that is so excited about what we're doing, the Teen Van has been in partnership with for over 25 years. And so we've been going there consistently. We show up every month. We take care of their young people. And when we go to them and say, hey, well, there's this new thing that we are doing in partnership with Stanford University, they're not going to immediately say no. They'll say, well, let's talk about it. Let's think about it. Let's talk with our teachers. And so that's been just another lesson in the importance of trust and showing up and being consistent kind of in these community relationships and settings. Next slide.
So
That's it. Thank you for your time. And, Professor Walton wasn't able to join us today, but he's been an incredible part of this partnership. And we're really excited to kind of take it to the next stage, as, Jesus mentioned, with our IRB approval and really starting to enroll young people in this program, getting those letters out to teachers in the schools and hopefully seeing the impact as well and being able to report back on that in the future.
Any questions?
Hi, this is Christina. It's more a comment, and I'm sorry I'm not on camera today. I just want to thank you all for your work. I'm in the maternal health, birthing, family space, and this is where so much starts in our lives and in our families. And so the way you're caring for folks in the future is just incredible. I guess I do have a question. So first of all, thank you. Second, because it sounds like the van has been in use for so many years now, when did it morph? Or was there a point that it morphed also into that kind of that research and really what are we accomplishing? Was that always in the plan? Did that come in the later years? Is there any history to that?
Actually, there has always been some element of research in the van's work, mostly oriented towards how do we take care of youth who have the experiences that many of our patients have better, because there isn't a lot of research in terms of serving young people whose lives have been disrupted by chaotic family lives and juvenile justice and criminal justice systems and being homeless and that sort of thing. So there have been research projects throughout I've been involved with the van on and off previously since 2000 when I was a resident and then a fellow, and then in the last 7 years or so as the medical director. And there's always been some component of research focused on, serving our youth better, understanding how to serve our youth better.
Thank you.
Sure.
I think Arash and Jesus, you would be happy to entertain email questions for those who have other questions.
Of course.
And I think this really shows how you really need to involve the community, right? In the work that we do, and we can't actually know the best way to serve them unless we involve them. And so that is a huge plug again for our community engaged research projects for health equity. I think we're going to open another cycle pretty soon. And I took the liberty of saying this was the inaugural presentation of the projects. But there are so many amazing projects like this that I think really we can learn from and showcase this relatively new methodology that the medical center, the IRBs are having a challenge learning how to integrate that. And if there are not further questions, then I think we're 1 minute behind schedule. So thank you
Thank
guys
you all.
all.
Thank
Thank
you
you,
all.
everyone.
Bye-bye.